Hello, good afternoon, everybody. This is Lisa Spears, and I'm going to be talking about my case conceptualization treatment plan on cognitive behavior therapy. And I did some research on this, and it was kind of interesting about my subject, my client, and it's actually someone that I actually met, and I kind of was talking to him. He's a friend of a friend of mine, so I'm going to do a little introduction here. His name is Taylor, and the AM is going to stand for adult male. He's 54 years old, African American male, who has been battling depression since the death of his wife. He's a senior pastor at a local church. His wife died of cancer almost a year ago, and he was the primary caregiver. They were married for 30 years. They have 3 daughters and 2 grandchildren. Some background information. No history of either substance use or abuse in the family. Started to become depressed since the death of his wife. Didn't allow the daughters to assist in the caregiving, and that was mainly not anything due to him, but that was the request of the wife because she didn't want to be a burden. And so she made him promise to be the only one that took care of her, not be a burden for the daughters. And of course, with that happening, that tends to cause division amongst the family, the daughters, because like any child, they want to be there when something is going on with either one of their parents, which caused them to be more and more withdrawn from interacting with their immediate family. So that caused them to have he lessened his interaction with the daughters to only Sunday dinners, which was a primary thing because Sunday dinner was something that the mother implemented as a way of getting everybody to sit down and talk. And it was something that had happened, that they had done since the girls were little. They always said that Sunday would be a time of family, and that's when they would have fun day, Sunday dinner after church and things like that. So when mom died, that kind of kept going, but it wasn't to the magnitude that it was. He still preaches on Sunday and at midweek services. Has received some counseling from a local pastor when his wife first died, but no professional counseling until now. So we're going to talk about some presenting problems that I noticed that he talked about, which was depression, hopelessness, not as in I don't know what to do, but hopelessness as in a way of despair, like lost, because when you're married to someone for 30 years, that's a great loss. And so it's a hopelessness as finding out how to adjust. And along with that hopelessness, there was some anger issues as to him blaming himself. It's like, what more could I have done? Did I do right? Towards taking care of her, being a primary caregiver, because now he realizes that even in that kind of pushed his daughters away. Of course, there's loss and grief that are factors here, which comes from the death of a spouse, and that's like that's a major thing when you lose a loved one. That's like high on your grief and loss suffering. So eating disorders, which causes eating problems and disorders, not to the fact that he's anorexic or bulimia, but your eating problems because he was used to his wife preparing dinner, so now you have to cook for yourself. So one of the things he talked about was having to not eat versus eating, because he doesn't like eating alone. So most of the time he's home alone. The children are grown, and he's in the house by himself. So there's no sitting down at the table and talking about your day. So eating alone presented some eating problems, and which will lead to some disorders if it's not if it's not addressed. The adult male doesn't feel like he is being withdrawn. He feels like he is doing his normal routine. Because he's used to just Sunday dinners, he feels like he didn't have to talk. But now that the void is there, well, the wife is deceased, the the daughters wanted to be more interactive, and he didn't feel like he wanted to stay normal as much as possible, going home Monday through working and then going home and having that time at home with his wife. But since she's not there, they don't see that as being normal. So let's talk about the contextual factors. And these were several things that we had to take into consideration in the contextual factors. I took into consideration the age, the gender, the family dynamics, meaning where the wife stood, what was her being the backbone, holding the family together, and with her being absent now, there's not a lot of stability right now. The culture, and of course him being a pastor, the religion, and then the cognitive ability. However, I did not assess with the DSM level 1 cross-cutting symptom measure, which was not administered. So these factors were taken based on, like I said, based on him and the culture and the family dynamics. So I began to implement a treatment plan, so I'm going to talk about that. I recommended a weekly 1 hour session for 2 months. Excuse me. And I did some research on Siegel, Williams, and Teasdale model of 2002, which talked about Pacific mindfulness approaches. And so I thought this would be beneficial to help him process. So I'm going to talk about number one, introduce. In the first session, I wanted to introduce mindfulness. And mindfulness is just him being cognizant of breathing, being cognizant of who he is, eating and exercising, and just getting back into a somewhat normal routine. With him being off of eating schedule, I wanted him to be mindful. So I introduced that into, let's be mindful that you do eat something on a daily basis. If it's not even but at least 1 meal a day, but it needs to be one full meal. Okay. And the next session we went with dealing with barriers. I wanted to say, let's deal with the barriers. And in that session, we wanted to explore the mental chatter that he was hearing concerning his body, concerning his mind, concerning his thought process. What are you thinking on mentally? Those things that would keep him from not being cognizant of his eating on a normal routine or normal basis. What mental blocks was that? I know she was the homemaker. She was there to cook dinner. She was there for dinner every day. So when that factor is gone, that leaves a void. So then when you don't have that, when he's used to that, then that's saying it's better to just not eat, because it's too painful to sit at the table and eat by yourself. Okay, so the third session was mindfulness of the breath. And so this was really a good session because I wanted him to just take a moment to breathe. And I think that's good for everybody, that we just take a moment and remember to breathe. And breathing sometimes causes us to focus and causes our minds to settle down. And that was one of the things I wanted him to just take a moment and breathe. Not because and not to be guilty because you're breathing and there's a loss and your wife is not there and it could have went a different way, but to just focus on himself, breathing, to calm him down, to remind him that there's still life, and life has to be lived. You don't want to just that was not one of the things that I wanted him to think upon. Would his wife want him to just be in this place? And so I wanted him to think about just breathing. I don't know if that was the best course of action, but I wanted him to just process where he was. And so we practiced that breathing space for 3 minutes. Take 3 minutes to just breathe and just to realize that you are still alive. Okay, then the fourth session was staying present. Let's stay in the moment. And that meant that let's be mindful of automatic thoughts that would lead to depression. Staying in the moment. What are you thinking on? Did certain things trigger you to be depressed? Thinking on things that that used to be. Sure, that would cause some type of depression. So I wanted him to stay focused, stay in the moment. And that breathing, 3 and 4 kind of went together. They were kind of conjoined together. That helped him to stay in a place where he would be in the mental, in the present, and be focused on what was going on. The fifth session was allowing and letting be. And this was going to be introducing acceptance and allowing things to just be. Um, Cooking for self. This is something that he had to come to grips with. Unless he wanted to eat out every day, and he was not a man that liked fast food, so he was used to a home cooked meal. So there was some factors, some things that was going to have to shift, and things that you were going to have to just let be. Either you were going to have the daughters come in and cook, or you were going to learn how to make that adjustment. So it was about processing through some things, which that was not an easy thing to just do, just process through it, but it takes time. So there was a lot of readjustment. The sixth section, thoughts are not facts. I know the thoughts are real. Not everything should is facts, like he was blaming himself. Should he, now he wants to second guess, should he have kept the wife promising he'd be the primary caregiver, because now it's such a division between him and the daughters. So that was those things. Could we have done something different? Could we have went to see different doctors, which led to him being angry. So I wanted him to process his thoughts. Let's be realistic in the thoughts, because there's a lot of anger there concerning the way things was handled medically, but and should he have stepped in. But that's processing those thoughts. Just because they're thoughts doesn't mean that they're facts. So I wanted him to be cognizant of what was real and what was realistic and what wasn't. Okay. Number 7, how can I best take care of myself? I thought this was really good, and so we introduced specific techniques for depression to hinder those depressive thoughts. Thinking on things, spending time with the grandchildren, just taking a few walks through the park. Let's focus on the now. Let's focus on things that are alive and things that are moving. Let's look at the good. Let's look at things that are happening, that has happened. And this was a good thing to do, because one of the adult children is military, so she's not always present on Sundays, and so talking with her on the phone would help him to process, and would help her to feel close, like as if she was there, literally physically there. And although she wasn't, it will help her mentally to process as well. And number 8, using what has been learned to deal with future moves. And so we learn how to motivate to continue practicing the the 8 steps of mindfulness approaches. They work together, all of those work together, but they have to be done consistently. So that was one of the things that we pressed into. Let's take what we learned. Let's take the breathing exercises. That was really good. Number 3, I think, was really good for him to focus on. So we went ahead on and set some goals and interventions. I set some short-term goals, which one of the short-term goals that we did was to increase and encourage the communication from the adult male concerning the death of wife and the void he is feeling. Communication was very needful for him, because I believe that it helped him to process through the death, grief, and dying. It helps him to process the loss. Talking about it helps to bring some reality, helps to bring back to reality. Although it's been a year, there was never enough time to process it. You hurry through the arrangements of the burial, and you hurry through people coming to visit, but you never take time to mentally process. And so how we measured that was, he has to be able to communicate more than 5 minutes when the daughters come to visit. Even if it's not on Sunday, for the regular Sunday dinner, I challenge him to talk more and to communicate more than just, hello, I'm doing good. Okay, thank you for coming by. So we took the Socratic dialogue to identify each family member's relational cognition patterns relating to family dynamics. So we looked at the fact that, and this was really helpful because although the mother although the mother was the backbone of this family, she was the strong one in holding this family together. The adult child one who is married and has a family of her own wanted to be able to step in and give dad some relief, but she was not allowed to do that, which in times she felt like she was not able to help her mother, aid her in going through this sickness. She felt like she was not there to give her the mental and emotional support that her mom needed, and that in turn caused her to have some type of resentment from her father with her father. So B is understanding the consequences of not communicating effectively, and those things, and by him not explaining to the adult child one that this was the wishes of her mother, he just let that anger and resentment build unnecessarily. And all it took was just effectively communicating. And I believe that the adult child, in talking to her, would have understood more had he said it then versus now. Long-term goals. We increase consistent interaction between adult male, adult child 1, adult child 2, and adult child 3 to reduce distance between father and daughters. And how we measured this was, and I keep going back to communication, is very, very key in interaction between them. They needed to feel the father's love with the absence of the mom and her not being there. They needed to have that support from their father, and the father needed to have support from the daughters. So we measured this about how he would be able to sustain consistent reinforcement for a period with no cancellation, because he had gotten to the habit where they would have dinner every Sunday to mostly having Sunday dinner once or twice, maybe every 2 months. So consistency for a period of time with no cancellation, trying to ease back into that every Sunday was what I wanted to challenge him with. We had to get some psychoeducational specific mindfulness approaches. That was one of the things I wanted to make sure that he understood what the mindful approaches were and why they were necessary. We had some issues in family schemas relating to grief and loss, getting information, getting education on that, how it's easy to shut down, but it's even more better. It's better to process it, even if talking about it hurts in the beginning, even if reminiscing or remembering those things that used to happen, or those events, or those dinners where she was very present. Even if it's painful at that moment, you still have to learn to work through that and talk about it. Talking is good. Talking helps you to process that person is no longer going to be a part, but that the memories are always good. The memories are always those to cherish. We also wanted to, in the long-term goals, reduce cognitive distortions that blame the adult male for not reaching out. We wanted to operate in the forgiveness, have the daughters come in and have him explain why his reasoning for not reaching out more. He didn't want to burden them. He didn't want his grief to become their grief, or his depression to become their depression, but also being able to receive the love from them. And so we measured this by being able to sustain non-blaming interaction for a period of 4 weeks without the adult male shutting down. And that took some time as far as allowing them to come in to one of the at least 3 of the sessions and talk about how they felt, how they processed the time that their mother was alive and she was sick, and they were not able to care for her as he did. And but it also was a time of forgiving, where they took away the blame. They realized that not one thing, not one person was to blame. They were all doing what they thought was best for the mother. Challenging cognitive distortions and identify more realistic perspectives. Also, make sure mindfulness approaches are being implemented. That was definitely going to be a long-term goal. I wanted to make sure that he was really working on those eight approaches that were going to help him to move forward even more effectively, helping him to understand, helping him to process. And the long-term goal was that I would verbally check in with the family every month after the treatment plan to make sure that to inquire about their perspective on the treatment. See, had they deviated, were they still going, was the mindful approaches being implemented as we had talked about? Were they still, how effective were they now versus when we first began? So in conclusion, cognitive behavior therapy, this model, family therapy, this model approach has been identified as an appropriate fit with African American clients because of the direct approach and focus on present problems. As a therapist, I want to develop an empathetic, supportive working relationship with families in which I am effectively and respectively provide education from a position of expertise. And I did take, I thought this was for a very um, easy, but not easy to the point that um, it wasn't doable, but I thought it was a very easy assignment to try to get to people to process understanding the loss of a loved one. It is a hard place to be in if you have not experienced that, but but when you have concern for people and and to be in this position as a therapist, it was kind of challenging because it's hard to keep your emotions out and not feel people, not have, not feel what people are feeling. Although I have not had a loss of a spouse or uh, a mother, a parent, but I can have empathy and to understand the love of a father, and to hear him say it was not intentional, and that to see them mending a relationship that was so strong, and to help him understand the loss that he had, this love that he had, this woman that he had loved for 30 years. It was not an easy task, but it was a good task. It was a good case for me to be a part of. It helped me to decide if I wanted to do cognitive behavior. I really love the mindful approaches. I thought they were very beneficial. I've worked them myself personally, especially breathing. There's times when I need to take a moment and breathe, but I thought they were very, very beneficial. This is going to be the conclusion of my case conceptualization. It was so much more that I could put in here, but I only had 30 minutes because it was so in depth. But it was, like I said, it was only 30 minutes class, and my presentation could have been at least an hour. So thank you guys, and have a great afternoon.